When you finally wake up from a knee replacement, you are physically and mentally drained. Getting through the surgery itself feels like a massive victory, but surviving the operation is only the first hurdle. Whether that new joint actually gives you your life back depends entirely on the physiotherapy phase that comes next. In the days immediately following surgery, scar tissue begins forming around your new joint. If you delay rehabilitation, that tissue hardens, leading directly to permanent stiffness and chronic pain. This diagram shows the primary physical goal of early recovery. Your immediate target is forcing that joint to achieve a 90-degree knee bend so you can walk without a stick. Pushing through the pain takes effort, but time is your actual critical currency. You have a very narrow 6-week window to get this right. This creates a stressful problem. You need immediate care, but you are forced to weigh out-of-pocket private costs against NHS wait times, all while trying to decode confusing medical credentials. This table shows the conflict. The top row is the strict 6-week ideal recovery window. The bottom row maps typical NHS wait times, which stretch for weeks before your first appointment. That gap leaves you stranded. Your joint stiffens precisely when you need aggressive intervention. To cut through this noise and figure out your best option, we are relying on the definitive knee replacement guide from The Best of Health, the UK's trusted healthcare resource for the over 50s. Passively waiting for the healthcare system to schedule your recovery is a choice, and it carries the highest risk for your long-term mobility. Before you look at price tags or clinic locations, you need a strict filter for medical safety. This decision tree filters out the noise. The absolute minimum legal requirement in the UK is being HCPC registered. You should also look for a CSP member, a voluntary mark showing they are committed to continuous, updated medical training. Checking these two online registries takes about 5 minutes, and it entirely eliminates the risk of paying for unregulated, dangerous medical advice. However, clearing this safety baseline only proves they are a legitimate professional. It does not mean they know exactly how to treat your knee. A cautionary note: a physiotherapist who spends their week treating hamstring tears in 20-year-old athletes has a completely different skill set from someone who rehabilitates post-surgical joint replacements. You need an orthopedic specialist. They understand the specific pacing required to force a surgically repaired joint into proper extension without tearing the healing tissue. Finding this specific expertise often means you have to look past the clinic at the end of your street and travel slightly further afield. That creates an immediate logistical hurdle. For the first 2 to 4 weeks of your recovery, you will be physically unable to drive a car. If you don't have someone who can drive you to a clinic multiple times a week, you need to book home visits. Home visits cost an additional £10 to £20 per session. In exchange, you eliminate the physical risk of traveling, and the physiotherapist can assess exactly how you navigate the stairs and furniture in your actual living space. Securing the perfect fit means balancing a practitioner's orthopedic track record against your temporary inability to leave your house. According to research data compiled by The Best of Health, the national picture for physiotherapy access is starkly divided. If you rely entirely on free NHS referrals, your out-of-pocket cost is exactly zero. The trade-off is time. You will likely wait several weeks for an opening, missing that critical early window to aggressively mobilize the joint. Committing to the private route guarantees immediate, personalized care starting just days after you leave the hospital. To get that immediate access, you pay between £400 and £900 for a full course of 8 to 12 sessions. You are choosing between a path that is entirely free but dangerously slow, or a path that is immediate but highly expensive. Because most people cannot afford the cost of one or the delay of the other, you have to build a strategic middle ground. You don't have to choose permanently between your wallet and your mobility. You just need to map your strategy directly to your current budget. If you have absolutely zero budget, you must be proactive. Hound your GP for an NHS physiotherapy referral well before your actual surgery date to minimize your wait time on the other side. This diagram outlines the highly recommended middle ground, the hybrid optimizer. You spend roughly £250 to £400 for private sessions during the first critical 6 weeks. Once past the danger zone, you switch to free NHS or self-directed care, saving hundreds. If you are fully insured or paying privately, use your provider's approved list to guarantee coverage. Check their specific knee replacement experience before booking. A generalist will slow your progress. Whichever financial path you take, securing immediate guidance right after surgery is the single non-negotiable factor for a successful joint replacement. Here is your final post-surgery action plan so you know exactly what to do next. Determine your budget path today. Verify HCPC and CSP credentials, and prioritize specialists offering home visits. Your recovery timeline is uniquely yours, but you do not have to navigate it alone. For more comprehensive guides on knee replacement recovery, costs, and choosing the right care, visit The Best of Health at thebestofhealth.co.uk. Investing the time to find the right physiotherapist today guarantees your freedom to move pain-free tomorrow.